Gikiro kia utabia wa homa ya corona umuthi kirugameire gicunje kia 13 hari igana. Thirikari ikiruta mukana wa kuongerereka kwa namba ya arwaru angikorwo a Kenya no meguthie na mbere kuregeria mikana iria gathikitwo niguo kuhitana na king'uki giki. Kaunti ya Nairobi, Murang'a, Nyandarua, Kiambu, Kajiado, Lamu na Tana River ni gatagati ga kaunti iria igwetetwo gukorwo ari ugwati munene hari gutherema kwa murimu uyu.
This observation is consistent with the projections of increased spread of Covid-19 in the month of July and August, associated with the more transmissible Delta variant becoming the dominant strain in our country.
Kaunti-ini ya Nairobi gutire na itanda cia kuigana kwa mukira arwaru a corona kurumirira na banene ya arwaru aria marakinyo thibitari-ini o muthenya mari na mathina ngurani kurumirira murimu uyu.
We are increasing the ICU capacity in KU, in Kenyatta National Hospital. I am aware that Nairobi Hospital is also increasing its ICU capacity by some 20 beds. We are increasing by some 28 beds at KU. But the truth of the matter is that unless we can contain it at this level, unless we can stop the transmission right now, then it is possible that our health system is going to be overwhelmed.
Arwaru ngiri imwe magana mana ma 32 makomete thibitari-ini ngurani guku bururi-ini igana rimwe ria 75 mari ICU gatagati kao 41 mari mashini-ini cia kuhuhia riri 82 maraheo riera nao angi 52 magithie na mbere guthurimwo ni marigitari. Thirikari cia kaunti ni ciuritio gutigirira ni cihaririirie kuigana na gutigirira o thibitari iri na riera ria kuigana.
And we want to emphasize that the saving grace in most of the case management is the presence of oxygen or the availability of oxygen. Experience in other countries also showed that those countries that had sufficient oxygen managed to save more people than those without.
Maya magithiaga na mbere thirikari yugite ni kuheana mwerekera wakana mundu ni agiriire gutukania njanjo mihiriga iri na ni njira iriku ikuhuthika kuheana njanjo iria itanyitwo guku bururi-ini ica ikuhi.
We are still encouraging that those who got AstraZeneca initially, it's encouraging that you still get your AstraZeneca if you can get it. As we continue, we advise them later on how that mix and match is going to work in the country.
We will not be vaccinating anybody who has been fully vaccinated with AstraZeneca and now vaccinate the same people with Pfizer.
Gukinyiria riu andu milioni 1,712,550 nio marikitie kwamukira njanjo hari aya 1,158,280 nio mamukirite njanjo ya mbere riri angi 642,270 nao marikitie kwamukira njanjo ya keri.
Our people.
Hadwini ha Kameme TV.